Thank you so much, Dinga. Yes, mining in the province is one of the pivots around which the economy of the province revolves. I mean, it contributes about 40% to the gross domestic product in the province. I mean, the province has 4 of the biggest mines in South Africa and one of the biggest in the world. So you could see that it was important or imperative to reopen the mines so that operation could continue, as it is the anchor on which the economy of the province and the country, sit, and that's why the Premier had the meeting with these mining chiefs or mining captains from all these big mines, your De Beers, for instance, and we don't really know what came out of that meeting. It was a virtual meeting, as you said, online, but the Premier joins us now exclusively to talk about what came out of that meeting. Premier Stan Mathabatha joins me now. Premier, thank you very much, and we really appreciate your time. We know that you have a very tight schedule. And if you could share with us what came out of that meeting you had, I think, from 9 o'clock this morning.
Yes, you see, we requested for that meeting as a province because we understood that we needed to mobilize all the forces that are at our disposal in this province, due to the fact that we are a rural province. We don't have resources. We've got limited resources. In case of a worst case scenario, we are going to be found wanting if we don't bring on board the mining houses, because mining is the big business that we have in this province. So we met with them, we agreed on a number of things and a way forward. The way forward being that we'll have a task team with them that will start operating with effect from Wednesday. In the coming 2 days, that task team must have met. And then within the factors that we wanted them to take on board in that task team was, one, the issue of beds, the availability of beds. Already, one of the companies there, which was there, had already promised us that they can make around 1,648 beds available already. So you can see that already that is going to make a very serious impact for the province, both for quarantine and isolation. But that was not the only factor. The other factor that we wanted to take on board was the issue of the food security, and not only food security, let me say the food bank. Remember, we have established a food bank, provincial food bank, and a district food bank. We were saying that as a province alone, we will not be able to provide sufficient food for that food bank, but with their partnership, we'll be able to do that. The schools are due to reopen. We're just not sure when will they be reopening. But when the schools are going to reopen, we are definitely going to need more resources, to ensure that at the end of the day, the teachers, the students, the kids, everybody is safe, because we don't want an outbreak in this province that will surprise us, There was a number of other issues that for example, the PPEs, other PPEs, availability of PPEs. They made their own commitments as the mining houses. Remember, even the Council of Mines was represented in that meeting. Thank you.
Premier, we're now at 54 cases here in the province, and although we have about 30 recoveries, just a few active cases. It has been reported that 7 of those cases were detected in 2 or 3 of the mines. How true is that? And have you touched on that in that meeting?
Yes, we did touch on that. And the MEC for Health was there, and she was very emphatic and strong on that matter, because she was actually saying that the rate at which we were getting cases in this province was at about 2, 1, and so on. But now, in the past 2 days, we got about 8 cases already, which therefore, and all these 8 cases come from mining areas, Duatsi, Lepalale, and Mohalakwe, Then that says to you that it has a lot to do with the reopening of mines. Yeah. You are very true when you say about seven cases came lately now. It's a worrisome case for us. It's a worrisome matter for us.
Thank you so much, Premier. We know you have a very tight schedule, and thank you very much for
You're
it.
welcome.
Thank you so much. Yes, as the Premier said, the MEC for Health, came out guns blazing, blaming the rise of the hike of these numbers to just the previous window period, the inter-provincial movement, because on the 16th of March we were on 2 cases, and now we are now at 54, and now she blames that on the inter-provincial movement, where people were allowed to move from one province to another, believing that some of the people who work here but live in the other province were holed up in those provinces during the lockdown, but then they were allowed to come through during the inter-provincial window, and that's why there has been some transmissions.